This is the STS Intermacs Pedimacs database webinar. Our agenda today, we've done the welcome. We'll have some STS updates. Dr. Ryan Cantor and Maceo Cleggett from Kirkland Solutions they are gonna go over the new reporting additions for y'all's, the QA reports. And we also, if we have time, we'll go over a couple of education points, and Patricia and I will do that, and then we'll have time for Q&A. Remember that Q&A, please use the Q&A box and not the chat box for questions. So the STS updates, we do have the AKO Hot Topics webinar. It'll be the Intermacs Days, December 14th at 11 a.m. Eastern Time to 3 p.m. Eastern Time. And we'll talk more about that later. And just a reminder to submit your data by December 31st, 2023 to be in the Q4 report. I want to thank everyone for attending AKO 2023. I believe the recorded content is still available for viewing. You can click on the presentation you wish to view and click join session, and Q&A is available to watch after the presentation. The deadline to complete all evaluations and claim education credit is Friday, December 9th, 2023. And we're back to the in-person meeting for 2024, which will be exciting. I don't think we have a location yet, do we, Carol?
No, not that we can say.
Okay, great.
But it's coming soon.
Good. So be on the lookout for that. That'll be something really exciting. I don't even know, so I'll be just as excited as y'all are. Again, we have the Hot Topics webinar. We're going to keep talking about this for the AKO attendings because it's a really great session to be in, or it is from 11 a.m. to 3 p.m. Eastern Time. If you can't block that time off, even if you join for 1 or 2, we're going to discuss right heart failure. We're going to have some clinical scenarios. We're going to have some discussions about case scenarios also, and how sites utilize their Intermacs data. And we also have Dr. Grindstein's going to go over his hematological and presentation. So it'll be a really good presentation. And Patricia, do you have anything to add to that? I think I covered everything.
I think you kind of covered it all, Catherine. No, I don't really have anything to add. There'll just be some really great discussion and a great opportunity if you do have questions. Lots of great resources will be on there if you do have questions, so it's a good opportunity.
Yeah. Thanks. So now we'll go to Dr. Cantor and Maceo to go over the STS reporting, and I'll stop sharing, Ryan, so you can set yours. Oh, there you go.
Great. This is Ryan. Do you guys see my screen okay?
Yes.
Okay, I just have a few slides here to update on what we're working on in terms of the quarterly site reports. We normally have a breakout webinar specifically for reporting and dashboarding, but I think since this is the last one of the year, we just wanted to get this on everyone's radar that we do have some edits that will be coming out in December. Let's see. So the first one, and we've been talking about this for a while, and we're actually getting it into place. We're going to update the way we break patients into the prior versus primary group. So the prior patients with a prior MCS support currently includes temporary and durable devices. And we're going to make that version of the report specifically prior durable support. And what that'll mean is patients with a temporary support before their first Intermacs device will now be grouped in that main primary patients. And I think that was kind of the intent all along. We just had to wait till we had enough data from the version 6 changes where we specifically asked what kind of support the patient had before their first Intermacs device. And none of this will affect the all patients report. We're on track to have this launch for the 2023 Q3 reports, which will be distributed at the end of December. The next thing that a site brought up that I thought was actually a really great idea is to refine how we do the cumulative report, like what the coverage of that report is. So right now, in the cumulative versions of the reports, whenever your site is compared to the Intermacs aggregate, that Intermacs aggregate is all patients in Intermacs across all time. This includes historic patients and devices all the way back to the launch of Intermacs, which was in 2026. So what was suggested to make the comparison of your hospital with the aggregate a little bit more appropriate was to limit the comparison group to the time frame in which your site has been implanting and entering entering patients into Intermacs. So for a good example, if a site joined Intermacs in 2019 and their first implant entered into Intermacs was in June of 2019, the cumulative report, the comparison group, would be limited to Intermacs patients since 2019. And that way it would exclude historic patients, on older devices that really, don't make it as good of comparison as it could be. So we think this will be particularly helpful for centers, that have joined recently or, really in the last 5 to 7 years even. And this is on schedule to be distributed at the end of December for those 2023 Q3 reports. The next exhibit is kind of in its design phase. We got some ideas on the last webinar on how to do this, but I've realized I'm going to need to talk a little bit more with Intermacs leadership and to implement it. So we'll plan on launching this the first quarter of in 2024 in March. And so this will be getting a little bit more granular information on the device malfunction and pump thrombosis adverse event rates. So it was requested that we do a breakout of major versus minor. And it was also requested that we do a breakout of whether or not the device malfunction / thrombus event was patient related or device management related. So the thing is, these two questions were added in the version 6.1 release, which went live in the end of 2021. So when we create these new adverse event rate calculations, we'll need to limit that to patients implanted since that launch of the questions to get accurate comparisons. Okay, so what this might look like is similar. This is a screenshot of Hospital X, so not a real hospital. But right now for the device malfunction and pump thrombosis rates, we have those calculated individually there for the site versus the aggregate. But we can add additional lines here for device malfunction major, device malfunction minor. I still have to figure out, do we want top level patient related, device related, management related, or should those be split out into the device malfunction patient related, pump thrombosis patient related? So I'll talk to the Intermacs leadership to get a little bit more clarity on what will be most useful. But we'll have an exhibit, either standalone exhibit or integrated into this exhibit, where for patients implanted since the version 6 launch, we'll be able to give a little bit more granularity on, I think it will be particularly interesting on what these major adverse event rates are. So that's what's on the agenda now for kind of the upcoming report edits, but feel free to reach out, send Catherine or myself any ideas or type them in here. We like to collect as many ideas as possible, and when we see things that will be of particular use to all the sites, we try to continually add edits to improve these reports. So that's all I have on the reporting. I did have one other thing I wanted to update Catherine, if that's okay. As I've been talking, I reached out to Brandon Singletary to see what are the edits that are planning for the dashboard. We just did a release for Pedimacs last quarter. So early in 2024, we have a few new exhibits that will be coming out on the Intermacs dashboard. So we're going to add more filters. We're going to add primary VAD versus prior durable VAD, kind of using the same definitions. We're going to add renal dysfunction as a filter, whether or not they had pre-implant renal dysfunction by the kind of the standard severity scale. We'll also do something with dialysis on that filter I'm seeing here. And in terms of outcomes, we're going to add a 90-day renal dysfunction and add a 1-year outcome for death and possibly others. So those are what's in the queue for the dashboard. And then any of those outcomes that we add to the dashboard will also add to the outcome analytics time to event tool. And again, with any dashboard ideas or edit ideas, send them our way. We like to log all of those and get them in the queue for evaluation and then release. Anything else you want me to talk about, Catherine?
I don't think so. I did have a question about the dialysis on the dashboard. So you'll have it'll go out like chronic versus acute.
I really just have a brief note here.
Okay.
I'm having trouble deciphering like if that's just incorporated into renal dysfunction, like that
Okay.
might be like a level of renal dysfunction, like renal dysfunction severity or dialysis. So I think that's the intent, but
Okay.
as we start working on those in earnest, probably in January, we can circle back with you to make sure we have the right specs on those exhibits.
Yeah, that'd be great. And this looks great, Ryan. I mean, I know the site should be excited for this because they've been wanting this broken down for a while. So that's really great.
Awesome.
I will say, just to the audience, I know we have a small group today, but this is your chance. You have Dr. Cantor and Maceo here on the webinar, and this is very rare. Happens 3 or 4 times a year. So please ask if you have any questions about the reporting or the outcome analytics. This is your chance to ask them. Because I know Patricia and I receive many questions regarding the reports. So this is your time. So I would really highly recommend that you, if you have any questions or if you think of any about the reporting or the any of the components or the dashboard, that you ask them. Go ahead. Share my screen again. I can tell you. I'm going to go ahead and move on until we get to the Q&A section. I can tell you that for the education part of this webinar, Patricia and I were going to talk about, I know we've been, we continue to harp on this, but the ECMO changes that went into place into the Intermacs database. I'm just wondering if we have any questions regarding that. I know Patricia did some great educational material with the PowerPoint slide, and she's gone in detail to explain that. But neither one of us have received any questions on that, so that actually may be that Patricia's really handled the educational part of this. But if you have any questions about the additional ECMO questions that we've added to the forms that we've added, that would be great to go ahead and ask.
Yeah, like Catherine said, I did do some educational slides. They're on our website with the rest of our appendices, educational material, and the slides are under Appendix S is in Sam. And it's titled, so it's a deck of slides. It's titled RVAD Changes. And it kind of just goes through some different scenarios to help walk you through how exactly this would apply to the different patients. We, like Catherine said, we added a question to the pre-implant, explant death, and implant discharge form to capture the number of days a patient was on ECMO post-RVAD support. So if you have any questions, you can reference those slides or reach out to me and I can assist you with that. So if anybody has any questions, feel free to ask them now. We can talk about them as a group, or as you're entering data, feel free to reach out to me.
Yeah, it looks like we have possibly one question in Q&A. Our
Quiet
meetings,
watched.
yeah, Trisha. Hey, Trisha, are meetings recorded to review at a later time? Yes, they are. This will be recorded, and also the slide deck will be posted on the STS website, and it'll be under the Intermacs webinars. So I'm going to go ahead and we'll review the rest of the slides since y'all are pretty quiet today. So the upcoming Intermacs webinars, the next reporting webinar will be January 25th at 2 p.m. Central Time. And the next Intermacs and Pedimacs database monthly webinar will be January 31st at 1 p.m. Obviously, this is open discussion, and we do encourage your feedback and want to hear from you guys. Here's some contact information. You have my contact information, I have Patricia's, and then we also have Macio's for any, he's our reporting resource. He handles all the reporting, zips the files up, and sends out the reports. So he's very, he knows a lot about the reporting process. Also, I've included the link for what I call All Things Intermacs. This is where actually it'll take you to the appendices where you can find the training manual. You can find the KCCQ, the Euroqual. It'll give you the contact for Jeannie Ann because you'll have to contact her to get that. But it'll have the adverse event definitions, and there's other training videos on that site. And so I'm hoping y'all have some questions, but I want to thank everyone for joining. Y'all are being a very quiet group today. Here we go.
It might be turkey overload, Catherine.
I was thinking the same thing as if everybody's still recovering from Turkey Day.
It might be turkey overload. Everybody's
Still
still waking
sick.
up or getting caught up on work
I know.
from being
We do.
out.
That's right. It was kind of a teaser being out for a few days and then coming back.
Yeah, and then have, eating all that food.
That's right.
I was like, here, you're gonna have a day off, eat all this food, and then try to go back to work for 4 weeks until the next break. And we'll
That's
do it again.
Let's see, Bill Stewart. How on earth do I get added onto the webinar series and calendar invite? I've submitted multiple times to be included, but never get any invites. If you are a member at a site, if you're a data entry or an site admin, or if you have any user rights for a site, you should be on the list. But I can definitely have, I believe, is it marketing that can look into that, Carol or Leanne?
Yes, I would send it to marketing and Addie,
Okay.
and they can check to make sure the name is on the list to be sent. And then if it is, they can check on the emails when they're sent. We're able to see, if it gets stopped along the way where it gets stopped at. and
Okay.
why.
Bill, if you can just like put in the Q&A what site you're from, if you know your Intermacs code, or you can just tell me what site you're from, because that'll be really helpful when we're trying to look this up. Okay. And how do we register for the webinar December 14th? There will be an email going out shortly regarding that, and it'll have a link on it, or actually a tab that'll say join webinar, and that should be going out, I would think next week.
I think so. Yeah, I think Emily is working with
Yeah,
David
or
on
even
that.
later today. Yeah.
Yeah, oh,
I
good.
know. Yeah, we're in the process for sure.
Great, thanks. I believe we used to receive email reminders with link, etc. for webinars. I still receive for STS, but not for Intermacs. You should still be receiving that for Intermacs. That's another question I will ask marketing. Bill says he seems to be on no list. Okay, you're at Spectrum. Okay, I will definitely get you. We'll look into this, Bill, and make sure you get on the list. And it looks like we'll give everyone another minute or two for any more questions. And then we'll go ahead and give you your time back so you can go take a break or get back to work. Well, it looks like this
Oh.
is all. Oh, one
Oh, you
popped
got
up.
to take her.
I gotta take her.
Yeah.
Thank you. Lauren, we're having the same problem at VANG. I believe we used to receive email reminders with link, etc. for webinars. I still receive for STS, not Intermacs. I
What
will
the heck?
definitely look into that.
You know what though, Catherine? Did you see one go out this week for today's
I
webinar?
did not. I did
I
not.
don't think I saw it
Yeah, I
did
either.
not.
Maybe
did
we
not.
need to check with our marketing team on that.
Yeah.
Okay.
I was just looking too. I didn't see one.
Okay.
Well,
Thanks.
sorry
We'll
about
definitely.
sorry about
Okay.
that, everybody.
Yeah, sorry. We'll get that corrected for the next webinars for sure. It's been well over a year. Okay. We'll definitely get into that, Bill. We'll look at it. Okay, well, I think I'll give everyone some time back. And thank you for joining the webinar. I hope everyone has a happy holiday season, and we will see y'all back after the new year. You know, be sure if you have any questions, please contact Patricia and I, and we'll be happy to help. And thanks, Carol, Emily, and Leanne for joining from STS. And thank you so much, Dr. Cantor, Maceo, John, and Patricia.